The statistics show nearly 1 in 3 adults and 1 in 4 children in the U.S. have seasonal allergies. And Memphis is consistently listed as one of the worst cities for allergies. One local surgeon is providing a way for people in this area to breathe better, thanks to some help of new technology. To learn more about the procedure, we are live with Dr. Grant Muller from St. Francis Bartlett. Hi, Frank. How are you?
Hi, good morning. How are you?
All right, Grant. So if you could tell me, how does this surgery work?
Hi. Basically what I'm focused on is surgical treatment of chronic sinusitis. How this works is this is a minimally invasive surgery. So everything is done through the nose. There's no scars on the outside of the face. And I use these very high-powered cameras to look at the openings of the sinuses that drain inside the nose. At the same time, before surgery, I get a very high resolution CAT scan of your sinuses, so I know exactly which sinuses have inflammation and have polyps in them, so I can target those sinuses specifically. So I actually have that CAT scan pulled up in the operating room right next to the screen where my telescope is looking inside the nose. And it actually tracks, similar to GPS on a car, it tracks exactly where the tips of my instruments are going. And so the advantage of this is it keeps me safe. It keeps me away from critical structures such as the base of the brain, the eye, the optic nerve, some major blood vessels that go up to your brain. And then it also allows for me to see around corners that I wouldn't normally be able to see around with a camera, make sure that I'm getting rid of all of the sinuses that are inflamed so you have a better treatment outcome. And then also allows you to heal faster because I can just target those sinuses that are inflamed and keep the healthy sinuses there and intact so that you're able to heal a little bit quicker after surgery.
Okay, so what's the recovery period, and do they ever come back?
So the recovery period is a couple of weeks after surgery. Generally, I don't want you blowing your nose, doing any strenuous activity, using things like a CPAP machine for about 2 weeks after surgery. I would say symptomatically, patients feel better within a week or two after surgery. They're breathing much better, and that's mostly because sometimes I have to put in little splints on the inside of the nose that last for a week. But as soon as those come out in clinic, it's like a night and day difference for a lot of patients being able to breathe through their nose. Certainly, there's always a chance that you can need revision surgery down the road, but it's few and far between.
Okay, and so the ultimate goal, what is it?
The ultimate goal is symptom relief, really. It's, the people that have chronic facial pain, pressure, they can't breathe through their nose. They've tried all the different medications. They've tried Flonase, they've tried Neti-Pot and Navage. They're not getting those symptoms relieved. Those are the patients that really benefit from surgery. And the goal of surgery is to relieve those symptoms, both by providing a wider nasal airway, but also it allows better delivery of those medications to the sinuses to reduce inflammation in the long term.
And is there anything that can prevent anyone from doing this, or is there an ideal candidate?
So the ideal candidate is really patients that have chronic symptoms, so facial pain, pressure, trouble breathing through their nose, change in the smell, drainage out the front or the back of their nose, that have tried all the medications and they still have symptoms just after generally a good attempt of what we call medical therapies about 3 to 4 weeks. And if you're not getting relief within 3 to 4 weeks with those medications, you would probably benefit from sinus surgery. And so that's the ideal candidate. Of course, this is also used for patients with growths on the inside of their nose, whether those are benign or cancerous, or for other conditions like.
I believe you're frozen, but if you can hear me, I do want to know, do you need a referral? How can people reach out to you? He's back.
Yeah,
okay.
Absolutely. Sorry. So referrals can come from from primary care providers. I also work closely with a lot of the allergists in the area. I am primarily employed through West Cancer Center, and so while I am a head and neck cancer surgeon and do reconstructive surgery here, I do also do general ear, nose, and throat surgery, such as the sinus surgery that we're talking about. And so the appointments can be scheduled by contacting the West Cancer Center. Our number is 901-683-0055. And I'd be happy to see any patients in the clinic. Certainly, we are a cancer center, but I do more than just cancer surgery.
All right, thank you so much, Dr. Grant Miller. There were so many of us with allergies around here, so you really hit home there, and that is why you inspired our Live at 9 question of the day, talking about sinuses. The question of the day, you can hover your phone camera over the screen, look for the yellow bar, tap it, and vote. There is the QR code to the left bottom of this screen, and just hover that cell phone over it. The question, when you tap the yellow bar, do you suffer from seasonal allergies? A simple yes or no. We already have one yes, and we're going to share the results before the show ends.